The federal government sat down with provincial health ministers on Monday to try to settle a long-term agreement on the future of healthcare funding in Canada. But talks quickly deteriorated, and it doesn't look like a deal is being made anytime soon. Here with his take on what's at stake and what this means for Canadians, Evan Solomon from CTV's Question Period joins me now from Ottawa. Good morning, Evan.
Good morning, Ben.
All right, well, many provinces are calling the federal government's healthcare funding proposition a lackluster, take-it-or-leave-it offer. What is the offer?
Well, breaking news, provinces want more money. They always said they want more money. Now, you got to have a little background here. The government says, look, we're going to give you an increased amount of spending of 3.5% every year. That's an annual increase. Plus, we're going to add $11.5 billion over 10 years in targeted funding to things like home care and mental health. And then the government said, that is an historic deal. The provinces said, wait a second, that's a terrible deal. We're used to getting 6% more every single year, plus we need more, plus we've got an aging demographic. This is a terrible situation. This is a take-it-or-leave-it approach by the Trudeau Liberals. But hang on. Remember, it was Stephen Harper 5 years ago this week that just unilaterally, he and Jim Flaherty as finance minister, they changed the formula. And they said this, Ben, and it seemed logical at the time. There was no negotiation. We'll give you 6% escalator. That was always the way it was, the continuation. But as of April 2017, it's going to go to the rate of growth, however fast the economy grows, but will never go below 3%. Well, growth is less than 3%. So this April, it's going to go to 3%. The provinces have been used to that for 5 years, but they thought when Justin Trudeau was here, big spending Liberal, nope, he'll just crank it back up to 5 or 6%. No deal. So now the provinces are saying, no, we want it back to where it used to be, back to the future. And the Liberals are saying, sorry, we just cannot keep having growth of 1-2% and give you guys 5-6% of healthcare. That's not the way it's going to be. So now they have a standoff. And the big time, the ticking clock here is, well, the finance minister's got to build a budget. So right now, the government's playing hardball. And they're saying, okay, you don't like that deal, provinces? Fine. You're going to get 3%. And that $11.5 billion we promised, that's off the table. So where do we go from here? There's going to be more negotiations. Eventually, Ben, the provinces are just going to have to take the money.
Evan, I want to look at the big picture here because the previous Harper government was criticized for not fostering productive relationships with their provincial counterparts. And a lot of people thought with Justin Trudeau and his Liberals coming in with their sunny, more cooperative ways that it was going to be a turning of the page, so to speak. But they've already had friction on the climate change file. Now healthcare. Is this sunny ways just talk? Is this more of the same of the provinces asking for things that the government just will not give in on?
Well, there's a lot of clouds in the sky. We could certainly say that. Look, one thing about Justin Trudeau we've realized is it's not, the Harper ways are not done. He's adopted many of the Harper frameworks, and then he's added some. So on climate change, same Harper targets on climate change, but then he's added the national price on carbon. Healthcare, same formula, 3% growth, plus he's added other targeted funding, the $11 billion for home care and mental health care. So Justin Trudeau is not abandoning the Harper legacy. Much of his first year in power has been a continuity of the Harper legacy. Look, provinces always want more money. And Stephen Harper said, look, I don't want to squabble. He watched Paul Martin squabble for 5 days at Sussex Drive, ordering pizza. Everyone's fighting over each other. Provinces wanting more money, and they come up with a deal. Stephen Harper said, I don't want to do that. I'm going to just lay down the deal and walk away. That's literally what happened. And Justin Trudeau said, I'll give you 1 day, kind of split the difference. You know the formula, what it is. I'm going to add something. If you don't like it, we're going to go back to the Harper formula. And that has been the pattern with Justin Trudeau. So it's not sunny ways so much. He's Stephen Harper with a lot more sunshine.
All right, well, we only have a few seconds left. At this point, can a deal be reached? What happens if there is an impasse? Can the federal government simply impose a deal and move on?
Yeah, there are 3 things that can happen right now. 1, the federal government can do what they're saying right now. Okay, great. Leave it. we'll just have the existing formula. No more money, and you just get this 3% increase in funding, the bare minimum. 2, they can go back to the table and renegotiate again with the provinces. That's what the provinces want. They want to all get back together, lock themselves in the room, and basically bully the government into more money. Or 3, Bill Morneau can say, you know what? This formula we've got, we'll tweak it a bit. We're just going to book this into the budget, and that's your new formula. See you later. We've given you a lot more money. You've got to take it. Those are the 3 options. Provinces want more negotiations. And the government, well, they're deciding whether just to lay down the law. It was interesting to see last night, Ben, that Jane Philpott, the health minister, tweeted out late last night, I am profoundly sad about what's happened. What a personal term. You just very rarely hear a minister talk about these negotiations in such personal terms. She said, how sad she was. Bill Morneau said the same thing. They really wanted a deal. They're angry behind closed doors about it. I talked to sources in the Prime Minister's office. They thought they were close to a breakthrough. They thought these sunny ways would work. And then the provinces threw them some shade.
Evan Solomon, thank you very much. Vivid imagery this morning, Evan. Thanks a lot.
Well, you know, it's a weather report and a health report.
All right, we'll be back. Evan will be back with us on Thursday with a look at the top Canadian political stories of the year.